Okay, hello, Bonnie.
Hi.
All right. So you came here this morning.
Yes.
And said you been suffering from back pain for 25 years.
That's correct. Yes.
Yeah. Okay. So during the 25 years on and off, you
Yes.
have back pain.
Yes.
And but 3 weeks ago,
Yes.
you had the worse back pain.
Yes, significantly. Yes.
And
yes.
then affect your legs.
Yes.
And especially your right leg couldn't
Yes.
walk probably.
That's right. Yeah.
And also you couldn't sit for long.
Couldn't sit at all. Haven't been able to sit for 3 weeks.
Or haven't been able. And even go to bed and get up for your bed.
Very. Yeah. Just in pain continually, really.
All
yes.
right.
Yeah.
And you've been to your doctor.
Yes.
And the doctor gave you some.
Temazepam painkillers and some naproxen anti-inflammatories, and they didn't do anything.
All right. So and also he recommended you go to the
chiropractor, but a friend suggested yourself, and I felt that with the pain I was going through, this was more appropriate, and so it has been. Yes.
Okay. All right. So this morning you just came in with pain.
Yes.
And with back pain and leg pain.
Yes.
And very difficult walking, isn't it?
Yes.
And you've been on this bed for
Yes.
5-10 minutes.
Yes.
All right.
Yes. Yes.
So I just did some simple movement.
Yes.
And also with my hand
Yes.
on your lower back, push down a little bit.
Yes.
And then after a few minutes, you feel so much better.
Amazingly. Yes. Yes.
So the most pain seems gone, isn't it?
It's just made the world of difference. Yes.
Right.
Yeah.
So now you can move your legs.
Yes, I can
all right.
move. Yeah, I can move my legs.
Yeah. And then also move your back.
Yeah, like I said,
Like-
I can go
yeah.
dancing now. Yeah.
So you are very happy with that.
I'm ecstatically happy. Yes.
Okay.
Yes.
Okay. Thank you very much
You're welcome.
for
Thank
talking
you.
to the video. All right.
Thank you.
Okay. Thank you. All the best.
Thank
I will do more on your back, and
Yes.
even it's painful, but it's good for your future. All right.
Yes, okay.
It's make it not easily happen again. All
Yeah,
right.
okay.
Okay.
Thank you.
Thank you. So this lady tell us her story about her 25 years low back pain, and also the 3 weeks couldn't sit down, and then so I did some treatment, and then make her totally feel better immediately, just a few minutes. How did I do it? So I hold a skeleton, and we can see the low back have the 5 vertebrae that hold it. And these 5 vertebrae have most pressure from the whole body. So when we sit down or when we lift things, all the pressure going to this area, which is disc. And once the disc pop out, then can press on the nerves. And as well as when we have a lot of pressure from the gravity, and then we can see if the pressure increase like this, and we can see, and these 2 vertebrae can be shortened, or this one can be shortened. When they shortened, the fancied joint on this side, you can see, will squeeze the nerves. So I let her lie down and relax, and let her move forward, backwards, for maybe few hundred times. Same time, I use my finger to press it, and then make the narrowed fancied joint or narrowed vertebra, which is like lower 4, lower 5, or lower 5 S1. Okay, so make it move. So when we move forward, backwards, let the patient move, wiggle like a back wiggle forward, backwards on the side way. How did I find it? Because when I treat some pregnant women or big belly people, and then they couldn't lie on their front, so I have to let they lie on the side. Then when I press all the muscle, ligament, and then they feel quickly better. So I realize, okay, when they do the side movement, when I open or press on the ligament on the top of the top process of the vertebra, and then quickly release the pressure. We can see quickly release the pressure, and then the pressure released, and the muscle, ligament, tendon, they regain their length, and they are not squeezed on the nerves, and then the pain can be relieved. So many people, they think the pain is caused by muscle or by the ligament or tendon damage or twist. That's not the truth. The truth is when the nerves be pressed. How did the nerves be pressed? Of course, because our weight or lifting or standing or twist, it's the weight going down too much, and then the ligament tendon couldn't hold it balancedly, and also it's because it's too tight, and the facet joints around the ligament, around the muscle, everything too tight. So we need to regularly loosen up the ligament muscle, and then let the vertebra regain that distance. Then it can reduce the pressure between the disc as well as the facet joint. Don't give the nerve root any pressure. So that's the cure of the low back and disc problem. Okay, thank you. Hope you got something for the low back pain. Or you can do it yourself. You lie down and one hand put here, and then move forward, backward, and press all the vertebra for maybe a few hundred times. Maybe you can get better yourself. Okay, thank you for the watching. Okay, bye.